pathology. So lastly, just to kind of wrap up pathology, there are these things known as immunohistochemical stains. So what does this mean? All this means is that if I see a stain that's positive for something, then that means that it's coming from something else. Okay, so the best way that I can explain that is through examples. So if I have neuroendocrine cell tumors, okay, so tumors that are stemming from neuroendocrine cells, if I want to know that it's coming from a neuroendocrine cell, I have to stain for chromogranin and synaptophysin. Okay, so if you see something is synaptophysin positive or chromogranin positive, then you know it started from a neuroendocrine cell. Okay. Next, epithelial cells. So if I want to know if if a tumor came from epithelial cells, I have to do a cell marker of cytokeratin. Best way that I remember it is that keratin is found in our skin, and so in our hair and stuff like that. And so that's epithelial cells, and so that's how I remember cytokeratin is for epithelial cells. Next, Desmond positive tumor cells are going to be associated with muscle. Okay. GFAP is going to be associated with neuroglia, okay? And the last one that really matters to me is the S100. This is probably the most important one. If you see S100 positive, it stems from neural crest cells. And the ones that you're going to see it in are melanoma, schwannomas, Langerhans cell histiocytosis, among others, okay? But the S100, neural crest cells, melanoma, schwannoma, Langerhans cell histiocytosis, okay? Be aware of that one. Lastly, I'm just going to be covering normal aging to finish off the pathology section. So, what we need to understand about normal aging is that they like to ask just questions that make you think that the pathology there's some type of pathological function going on, and then you go and you realize that it's just normal aging. So be aware of that. At times they will try to trick you. If you see something that's like nothing's really going on, but they have like these odd changes to their body and they say that it's a really old person, put normal aging on your differential, okay? Not everything has to be some type of crazy, weird pathology. And you'll see that more often when clinicals come around. But just keep that in the back of your mind because they love to ask. I think there's probably about like 3 questions each in each section about normal aging. So just like be aware of that. Okay, first one, cardiovascular. We're going to see a sigmoid-shaped intraventricular septum. Okay, so weirdly enough, but we're going to get myocardial hypertrophy. And the reason behind it is because the heart beats multiple times a day, as you know, for a really long time. And if you live long enough, it's going to just become hypertrophied a little bit. And so you're going to get a sigmoid-shaped intraventricular septum, okay? And you're going to get a decrease in that arterial compliance, which leads to increased stiffness, right? And so then then we're going to have that decrease in left ventricular cavity size because of that sigmoid-shaped intraventricular septum due to the hypertrophy, all right? Very easy, logical, makes sense. You're going to see an increase in systolic blood pressure, a decrease in diastolic blood pressure, and an overall increase in pulse pressure. Next, for GI, we have a decrease or loss of LES tone, lower esophageal sphincter tone, okay? And we have a decrease in colonic motility, so increased risk of constipation. Next, hematopoietic stem cells, we're going to have a decrease in bone marrow mass, and that is just due to the fact that we have an increase in bone marrow fat. Okay, so we have blood loss. Okay, not blood loss, but if there is blood loss, then you're going to have problems kind of, responding to it because of the decrease in bone marrow mass. For our immune response, you have to remember that we have preserved memory B cells and T cells. So our memory B cells and T cells are fine, but we have a decrease in overall naive T cells and B cells. So we have trouble kind of creating new memories, okay? Now, the issue is that when we have new pathogens or vaccines that are introduced to an older person, they have struggles with maintaining that new response because of the loss of naive B cells and T cells, okay? And that's why it's really important to be providing the patients with vaccines, elderly patients with vaccines, when there's a new virus that comes along or a new pathogen that comes along, okay? Because they have preserved memory, B cells and T cells, but they kind of lose the ability to create new ones, okay? They have a less amount. Next, for musculoskeletal, they love to ask about the decrease in skeletal mass, muscle mass, as well as bone mass. You're going to see osteopenia. A loss of bone mass is really important for aging and musculoskeletal. The rest of them aren't really as important. I would say skin, maybe we'll see atrophy, as well as like some type of striations, right? We have that photo aging and chronological aging. But overall, it really isn't as important. For renal, we have a decrease in GFR due to the fact that we have a loss of nephrons, okay? And that leads to a decrease in renal blood flow, and overall, we have voiding dysfunction, okay? For reproduction, we'll talk about females having atrophy of the vagina, as well as vaginal shortening and thinning, as well as dryness, okay? And that's really important when we get to the repro chapter when talking about menopause. For males, we get testicular atrophy and we have a decrease in spermatogenesis, although we still have ability to produce sperm. The prostate enlarges, and that's why usually any male that lives long enough will mainly maybe see BPH, benign prostatic hyperplasia, although it's not going to be seen in 100% of all males. Lastly, for respiration, we have an increase in lung compliance and a decrease in that elastic recoil. And we also have a decrease in chest wall compliance, which leads to increase in stiffness, okay? So be aware of all this. It's also associated with normal aging. And the last thing I'll talk about is lipofusion. All lipofusion is this yellow-brown just material that's located within our cells, okay? And it's like pigmentation. It's associated with normal aging, and it's just composed of these lipids and proteins, okay? If you see it on histology of an autopsy of like a older adult, okay, then don't automatically, once again, go for something that's pathologic. If you see like something that's brown, it definitely could be lipofusion. It could be other things, but keep an eye out for lipofusion. It's very common amongst older people.